Welcome to the press briefing. On stage, we have Dr. Zhang Chok-Kwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Larry Lee, Chief Manager from Hospital Authority. Dr. Zhang will give us an update of the latest situation. Thank you. We received 447 cases positive by PCR and 345 throughout AT, with a total of 794. Cumulatively, in the fifth wave, we have 1.18 million, 4,447 positive cases. 742,157 tested through PCR, 442,290 through RAT. Among the 449 cases, 3 were tested positive by HA, 100 by Public Health Laboratory of CHB, 276 from private labs. The CHP laboratory did genome analysis on 237 cases. 233 were negative to L452R and 4 results pending or with too low viral load. We've got 12 imported cases, 11 positive through PCR, 1 through RAT. 9 arrived yesterday from 4 flights. 4 cases on KL819, 3 on CX865, 1 on 3S5161 TR810. 3 cases arrived earlier in Hong Kong. For elderly care homes with previous cases, now we have got 23 new confirmed cases among residents, 3 staff members, involving 27 care homes for the elderly and care homes for the disabled. For death cases, the HA has newly reported 41 death cases to us, tested positive by PCR within the last 28 days. A total of 8,838 cases have been reported, 59 reported from other sources. In the fifth wave, we have a total of 897 death cases with positive results. Among the 8,887, 3,665 were female, 5,232 male, aged 11 months and 112 years old, median age 86. Those below 18, they had 8, and those above 60, they account for over 96%. The death rate is about 0.75%. For those unvaccinated, it could be 3%, 1 jab, 0.99%, 2 jab, 0.16%, 3 jabs, 0.04%. So obviously, you can see the difference between having 1 jab, 2 jab, or 3. There is a very obvious difference. For those over 85, the gross death rate is at 10.34%. Without any vaccination, 16.3%. 1 jab, 6.8%. 2 jabs, 3.7%. 3 jab, 1%. So all these figures are available online. They are released on a weekly basis. And if you're interested, you can look for details online. That's all from me. Dr. Lee, please report the situation with HA. Good afternoon. 8,280 cases are being treated at different public hospitals, ICC, North Lantau Hospital, HAIDC, and AWE Treatment Center for COVID-19. 5 cases were reported critical last night. 1 unvaccinated, 2 with 1 jab, and 3 with 2 jabs. 3 serious cases, 52 critical patients are being treated at ICUs. As at 00 hours, in the past 24 hours, 34 patients tested positive passed away, 17 male and 17 female aged between 44 and 103. For patients who passed away yesterday, 14 came from care homes, 13 had no vaccination record, 8 with 1 jab, 12 with 2 jabs, and 1 with 3 jabs. 31 were over 65 years old. I've got 3 younger cases to report to you. One was a 57-year-old man who had 2 jabs of vaccine. He had chronic disease. Last year, he had stroke. And he had also got a platelet deficiency due to an immuno disease. On the 22nd of February, he was admitted through the A&E department of Rottenji Hospital. He was presented with confusion. He had a fever, and there were multiple bruises on his body. His platelets were found to be of a low level. Different computer scans showed that his stroke had deteriorated, and he also had edema. He had been repeatedly transferred between internal medicine ward and ICU, mainly because of his state of consciousness, and also to protect his breathing. He was once he had intubation. His condition continued to decline. On the 10th of April, when a PCR was administered, he was positive, and then he passed away at 4:30 a.m. on the 15th of April. The second patient is a 44-year-old woman who had chronic illnesses. She had no vaccinated record. He had both a heart and renal condition. She needed renal dialysis. On the 3rd of April, she was admitted through Yanji Hospital for shortness of breath. She was positive through PCR. We provided treatment, but her condition continued to decline, and she passed away in the morning on the morning of 15th of May. Another case is a 55-year-old man with chronic illnesses with 1 shot of vaccine. He had lung cancer with metastasis. On the 14th of March, he was admitted through the A&E department of Princess Margaret Hospital. He had shortness of breath with fast heartbeat, and then he had pulmonary edema. On the 2nd of April, he tested positive through PCR. We started drug treatment, including Pfizer steroid, and also randomized. And then 7 patients passed away, 2 men and 5 female, aged between 81 and 90. These unreported cases passed away a few days ago. 1 on the 12th of April and 3 on the 14th of April. 3 passed away in March. They passed away at our A&E department and were sent to public morgues for forensic examination and waiting to be claimed. And then when they had only RAT result at A&E department, and they were not confirmed cases. So we have followed up on these cases, and recently we confirmed with the CHP or Department of Health that they were confirmed cases, 2 on the 7th of March and 3. 1 on the 7th of March, 2 on the 9th of March. Please understand that because there were too many death cases previously, some of the test results were not confirmed, and they have to be verified before they can be confirmed. We'll keep reviewing the system, and should there be any updates, we'll make an announcement. In the past day, 808 patients were discharged. 4 was positive during a screening in ward, and 4 patients in the same ward are now close contacts. 21,823 staff members were confirmed. 20,815 have returned to their duties. Thank you.
Floor is now open to questions. Please use our microphone. Before putting your questions, please tell us your media outlet. We will start with a lady over there. I'm from cable TV. I want some clarification about the confirmed infections today. The total doesn't add up. You told us there were 447 PCR positive cases, 345 RT positive cases. Is that correct? 449 PCR positive cases. About a 57-year-old patient, the male who passed away. On February the 22nd, he was admitted at the A&E department of Ratanji Hospital. Was a test performed? Did he test positive at that moment? On April 10th, you said that he tested PCR positive on April the 10th. Does it mean he caught COVID in the hospital? Or was he already infected at the moment he was hospitalized? And some questions about imported cases. Does it mean all the flights involved have triggered the route-specific flight suspension mechanism? A question about the Ministry of Health from Singapore. They did a study. 2 doses of the Sinovac vaccine leads to a higher rate of severe illness, 4.5 times difference compared with the BioNTech vaccine. But since so many seniors are getting the Sinovac vaccine, and there's talk now that the seniors need to get 3 doses of Sinovac. Does it mean it's a better idea to give the BioNTech vaccine as the 3rd dose for seniors? About the imported cases, KL819, which is the flight, there were 4 infected persons on that flight, and for CX865, 3 COVID positive patients were on that flight under CAP 599H. For KLM and the CX flight would be barred from arriving from Hong Kong. The flights from Vancouver and Amsterdam between April 17th and 23rd. The scientific committee advises that 3 doses of the CoronaVac will be needed, whereas for community, the 2 doses will be required. For seniors, they need to get 3 jabs. In suitable cases, that means those aged over 60, they should get 4 doses. So we shouldn't be comparing 2 doses of Sinovac with 2 doses of BioNTech. For the 57-year-old male, on February 22nd, he was hospitalized. The hospital screening and the rapid test at the A&E department, he tested negative on both occasions. And on April 10th, there was a regular check. It was a PCR test. He probably got infected in the hospital. Next, a gentleman over there. I'm from Now TV. There were 3 relatively younger patients who passed away. One got 2 jabs and one got 1 jab. Could you tell us which vaccine did they get? Now we are getting fewer infections every day. Will you resume contact tracing to find out further details about each infection, such as where they have been to? Now, there are 2 Sinopharm vaccines approved for clinical trials in Hong Kong. Could you tell us about the details? Will you consider procuring the 2nd-generation vaccines to replace the existing vaccines? About the 1st and the 3rd case, 55-year-old male, rather the 57-year-old female male, he got 2 doses of Sinovac vaccine, and for the 3rd case, he got 1 dose of the BioNTech vaccine. There were 2 Sinopharm vaccines, both inactivated virus vaccines. They're undergoing clinical trial. The Department of Health has issued a relevant certificate for the vaccine so that clinical trials can be run. This is still at the stage of clinical trial, so we're not in a position to procure the vaccines. We're not resuming contact tracing yet because we're still getting so many infections. Next, we will take the question from the gentleman over there. I'm from Hong Kong 01. Recently, Hong Kong residents visited the mainland and they were required to do PCR tests on the spot, but the indeterminate results for some of these cases prevented them from going to the mainland. Why are they getting the indeterminate results? Does it have to do with someone not doing the things right during the process? Now, in terms of the class resumption, there are experts saying that we shouldn't underestimate the impact on children, but how should we proceed in that regard for contact tracing? At which level will we start resuming contact tracing for infections? Now, for indeterminate cases, the CT value tends to be very high. It could be that this person got infected early on without being aware of it. In other words, a really positive case. Or it could be someone in the early stage of an infection. So this is not a negative case. For schools, parents should arrange for vaccination for their children. As the pediatricians have told us, COVID could lead to lingering symptoms or complications in children. The best way to protect children is vaccination. Vaccination may not be able to prevent infection, but vaccination helps minimizing risks of serious illness and deaths. Apart from maintaining good personal hygiene, children should also do the rapid antigen test before going to school every day to minimize the risks. But most important of all is the vaccination. We don't have a specific number of cases where we'll start resuming contact tracing. Next question, the lady over there. I'm from Mingpao. First question for Dr. Larry Lee. Apart from the 57-year-old male, the 55-year-old male who passed away, could he be infected at the hospital? After all, he was admitted to a hospital early on. Do you have a tally in terms of those who passed away? How many of them were infected inside hospitals? What can be done to prevent in-hospital infections leading to deaths? Another question also for Dr. Larry Lee. In terms of the facilities, the various hospitals, how many are COVID beds? What's the usage rate? What's the maximum capacity of COVID beds in various facilities if a sixth wave of outbreak comes along? At which level would you start seeing it as a red flag and you have to warn the government that restrictions have to put in place? Another question for Dr. Chuang. Professor Sophia Chen mentioned contingency plans for a possible sixth wave. For the Center for Health Protection, do you have a specific indicator suggesting what's a normal fluctuation and what's an alarming surge? At which level of infection or surge would we have to start taking notice? And for the vaccines, about 3 doses of Sinovac and 2 doses of BioNTech. The advice has been around for some time, but the vaccine pass is premised on 2 doses of either Sinovac or BioNTech. Is there inconsistency here? Is there a need to make it mandatory that people have to get 3 doses if they're taking the Sinovac vaccine? For the 55-year-old male who passed away, on March 14th, he was admitted at an A&E department. On April 2nd, he tested positive to COVID. We believe this was an in-hospital infection. Our infection control team has reviewed the practices. If a sixth wave comes, we will stick to the protocol. For our isolation facilities, we have this multi-tiered triage and treatment strategy. For hospital beds, we have 11,500 beds in hospitals. As for the community isolation facilities, we have roughly 1,000 beds. That also includes the North Lantau Hospital. We have 8,000 or so patients staying at various facilities. 8,280 patients currently receiving treatment at various facilities. This reflects the progress we've made in the fifth wave of outbreak. The remaining capacity for now, we have to prepare for a possible rebound given the class resumption and more frequent social activities down the road. We also have to prepare for a possible sixth wave of outbreak. The remaining capacity we have, along with some social community isolation facilities, they will be a key part of our plan.
Speaker is off mic. So far not, but we believe we need a response plan. With gradual relaxation of social distancing measures, we're prepared for fluctuations or a slight rebound. In the number of cases, we do not have any hard targets. So how we would define it as a serious rebound. We have some important indicators, for instance, the percentage of positive cases in community testing, the results of sewage surveillance program, our data from Hong Kong U. These will help us to decide whether it's just a slight rebound or the sixth wave. The vaccine pass involving the third jab, I understand the administration has issued a press release by the 31st of May. All suitable persons should have had 3 jabs to be qualified for a vaccine pass. No, speaker is not coming through. The speaker did not use a microphone. We suggest the scientific committees suggest that people receive 3 jabs. If no other questions, the press briefing ends here. Thank you very much.